Hi there. In this discussion, we'll be talking about your correctable refractive disorders. So your error of refraction, take note, is a problem of our lens. Okay, so let's talk about correctable refractive disorders. First, you have your myopia. Myopia or nearsightedness. Okay, so what happens in myopia? The parallel rays of light would focus in front of the retina. So the big word there is that front of the retina. Due to the abnormality on the structure of your lens, the parallel rays of light would focus in the front of the retina. So what's the problem? The near vision of the patient is normal, but the distant vision is defective. Okay, because of the inability of the light rays to focus, supposedly your vision on your photoreception on the retina, supposedly. So again, as I have mentioned, it is focused in front of the retina. So there are possible transient causes, particularly your medications. So you have your sulfonamides, your acetasolamides. So recall your sulfonamides are antibiotics. Your acetasolamides may actually function as a diuretic. Then you have your salicylates, such as your aspirin, and then your steroids, such as your pred, your methylprednisolone, and your dexamethasone. So they could be transient causes of your myopia or nearsightedness. But when these medications are causing when these medications are causing your myopia or nearsightedness, it is only transient. Okay, meaning by the time that the medication is taken off from the patient, the signs and symptoms of myopia will also be off. So management. In myopia, it is managed by your concave lenses. Okay, the management is concave lenses. So if you would look at this, so what happens in your myopia or nearsightedness, okay, if compared with normal vision, the focal point supposedly of the things that we are seeing once it enters our eyes supposedly should be in the retina. However, due to the abnormality on the structure of your lens, what actually happens is that the focal point is transferred, okay, in front of the retina. Okay? The next problem that we would have is your hyperopia. Hyperopia is also known as farsightedness. So what happens in hyperopia is that the parallel rays of light would focus behind the retina. Okay, so unlike before in myopia, the focus of these rays of light is in front of your retina. In this case, it will be behind your retina. So what's the problem occurring to our patient? Farsightedness, meaning the distance vision is excellent. However, blurry and poor near vision would occur. So what's the impact on the quality of life of the patient? The tendency is that if you will be requiring close work or close eye work for this patient, and tasks like reading, it usually bring on manifestations of headache and eye strain. So their tendency is that if they are reading, so meaning they are using their near vision capabilities, they would easily have headache and eye strain. So if your myopia earlier was managed with a biconcave lens, your hyperopia is best managed using your biconvex lens. So you might be wondering what a concave and convex lens would look like. So concave lens would look like this one, and then a convex lens would look like this one. So if you can recall, your myopia is used for concave, your concave lenses, is used for the management of myopia, whereas your convex lenses are used for the management of your hyperopia. So if you can see, this will be the effect. So this is the vision in myopia. Recall earlier that the focus is in front of the retina. So this is your retina, the orange line here. Okay, so for us to make the focus go towards your retina, what we are doing is to apply a concave lens. And when you are using the concave lens, the tendency is for the light to be have a longer spectrum, or the light wave will travel longer, so it will be on the retina. So hyperopia. In hyperopia earlier, we said that the focus of light is behind your retina. So we would want the focus to go back, okay, to the retina itself. So hence we are using a convex lens. Okay, so the purpose of the convex lens is to place it back to the retina. Okay, now you have the term presbyopia. Presbyopia is usually associated with the loss of accommodation due to the aging process. When I say aging, this might not really mean that we are talking about 60 and above, but your presbyopia could start to occur in people in their 30s and 40s. Oftentimes, we stereotypically call your presbyopia as old sight. which would be indicative of lessening of the effective powers of your accommodation, a decrease on these powers. This occurs because of the hardening of the lens due to the aging process. And that would lead to blurring of near vision, and they would have visual fatigue when doing close eye work. Okay, so the management for this is the use of your convex reading glasses. The next disorder that we have is your astigmatism. So your astigmatism is distorted vision, having distorted vision, which is caused by the irregular curvature of your cornea. Okay, so oftentimes caused by structural problems on your cornea due to exposure to irritants, or maybe rubbing of your eyes, or even prolonged exposure of your eyes to irritants to the irritants. So this is caused again by irregular curvature of the cornea that would prevent a sharp image focus. So what happens is that it would diffuse the light rays on the retina. So the image on the left is an image of a patient with what a patient with astigmatism will be seeing, in contrast on the right, which is the normal image. Okay, so what is the cause? Again, it's the variation in the refractive power along different meridians of the eye, so leading to the inability to focus of the light rays towards the retina. So what happens? There is optical distortion caused by irregular corneal curvature, which prevent clear focus of light. And the management for this is the use of your astigmatic lens or your cylindrical lenses. Okay, so one surgery that we can do for a patient with astigmatism, or maybe for a patient also with myopia, is your LASIK surgery. Okay, so your LASIK would stand for laser-assisted in situ keratomiliosis. So this is related to the vision of the ophthalmology to have customized vision correction with the goal to achieve your supernormal vision. So you have your laser eye surgeries already, and part of your laser eye surgeries is what we commonly refer to as your LASIK. So your LASIK could be used for patients with low to moderate high amounts of myopia, hyperopia, and astigmatism. Again, it will be for patients with low to moderately high amounts of nearsightedness, farsightedness, and even astigmatism. So what happens here? Okay, this is just a short diagram or illustration of which. So there will be an application of your topical anesthetic, and then the cornea flap will be created. The laser will be used to sculpt or shape the lens. And then what would happen is then once it is already shaped, the flap will be repositioned, and then the corneal curvature is flattened for the case of myopia. Okay, so just for you to have an overview. So notice if how small the instruments will be used and how delicate the movement of the doctors would be, okay, to address this structure. Okay, another one that procedure that could also be done is what we refer to as your corneal molding or orthokeratology. Again, it's corneal molding or orthokeratology. So this is the use of specially designed rigid gas-permeable contact lenses to alter the shape of your cornea. So this is indicated for patients with myopia and moderate astigmatism. So then you have your aphakia or aphakia. So your aphakia, the cause of which is the absence of the lens, which could be congenital or could be caused by the removal during cataract surgery. So what would the effect? The images are projected behind the retina, which would cause some symptoms like your hypermetropia. So when I say hypermetropia, it's just like your hyperopia or your farsightedness. And then there will be loss of accommodation. Management, you could use your aphakic glasses, special glasses for aphakia. Then you have your contact lenses, and then your ILOs, which is your intraocular lens implants. Okay, then you could use your contact lenses also for those corrective or refractive disorders. On the use of your contact lenses, take note that contact lenses may be working as plastic or silicone substances. Okay, they work like eyeglasses. However, of course, they're directly placed into your eyes. They're highly permeable to oxygen. They have high water content, which would be equivalent for greater wearing time with greater comfort on the part of your patient. However, you need to warn your patient about the RSVP. What is RSVP? Redness, Okay, sensitivity, vision problems, and pain. Okay, because this may indicate that there is an ongoing infection on the eye, or this may indicate that the eye is having irritating reactions towards your contact lenses. Okay, which means that it needs to be managed. So there are patients who are opting for the use of contact lenses because they find it more convenient compared to the use of your eyeglasses. So you need to advise them that they need to consult a doctor for that. Okay, now since I mentioned about a doctor, let's try to differentiate an ophthalmologist from an optometrist. Okay, and be aware of their difference for our live discussion. Our next topic will focus about extraocular disorders, inflammation, and infection. Thank you for your attention.